I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. The coronavirus outbreak is the biggest crisis our county has faced since our bankruptcy. But this is worse. The bankruptcy crisis is about money. This is about health and safety of our citizens. Last night, I co-hosted a teletown hall with Vice Chair Andrew Doe, Orange County Health Officer Dr. Nicole Quick, and Orange County Healthcare Agency Director Richard Sanchez to address questions and hear some concerns related to the coronavirus pandemic and what Orange County is doing to protect its citizens. Our teletown hall had over 20,000 calls and social media comments, which shows that our residents are very much concerned about this issue. Our healthcare professionals work to answer as many questions as possible and to clear up any misinformation about the current status of the outbreak. We have been actively listening to your questions and concerning during this crisis. I am supporting the county superintendent of schools' recommendation for school closures in order to prevent any community spread of our students. I will also be asking the county to work with nonprofit agencies to provide resources for low-income families so our children can be fed while school is closed. Additionally, I will be requesting the county begin to provide hand sanitizers and alcohol wipes to residents of the county. As we work to provide you more information about these concerns, I am also announcing that we will have special Board of Supervisor meetings every week with our regular meetings. We will have all relevant county agencies provide regular updates on the efforts they are taking to stop this virus. We will also be asking the Sheriff's Department to update on the status of jails and the Healthcare Agency to update on the status of shelters. I'm asking Vice Chair Doe to lead this effort. I ask county staff and the county public health officer to update us daily on the availability of test kits, the number of tests being conducted, and the status of confirmed cases in the county. We must provide transparency to the public about the numbers of testing kits for those who need it. This will give Orange County residents the opportunity to be updated directly by myself and our colleagues on the status of this virus every day. I'm encouraged by President Trump's announcement today that more test kits will be made available. We will continue to update our residents about the number of test kits available in Orange County. Our top priority is protecting public health and safety, and we are working with the County Healthcare Agency, our first responders, and law enforcement to do everything in our power to protect you, the Orange County residents. We have with us is Dr. Richard Sanchez, Director of the Healthcare Agency, David Solelas, Deputy Director of Public Health Services, and Orange County Department of Education Health Coordinator Pamela Khan. I will now turn into Vice Chair Doe. Actually, we have our Orange County Sheriff Don Barnes is here, and I'm going to turn it over to Vice Chair Doe.
Thank you, Madam Chair. And we also have with us Captain Holliday from the Orange County Fire Authority. Before I start, you probably hear my raspy voice. The demolition of 3 buildings right next to our office has done wonders for my allergies the last month, so it's not coronavirus. So in light of the national emergency declared by President Trump today, together with the many closures of the different institutions and cancellations of events that we have seen across the county, state, and our nation, the residents of Orange County may be confused as to where we are in our county in terms of the number of cases, our ability to test anybody who may be infected, and more importantly, where do we go from here with all of the declarations of emergencies and the advisories coming down from both the federal and the state level. What should we do as a community? And today is an effort by the chair and I to announce the concrete steps that we are taking here at the County of Orange to respond to the novel coronavirus, also known as COVID-19. The importance of what we are announcing today is that this will be the game plan that the county will apply going forward until the end of this crisis to ensure that our citizens are protected from the disease and the basic needs of our people are met, especially the needy and the vulnerable population. The challenge we face is how do we get word out to the hard-to-reach population, the underserved communities, to get the message out, to help to prevent further spreading of the disease. Now, I want to make sure to emphasize that the risk of coronavirus infection in Orange County is still low, but we want to take strong actions to ensure that the virus doesn't gain a foothold here in our county. We have, as of right now, the latest number updated by the healthcare agency is we have 9 active cases of coronavirus in the County of Orange. 6 have been tested positive by the county and have been confirmed by the CDC. 3 positive tests by the county still await confirmation by the CDC. So that makes 9 active cases. We don't have any evidence of any widespread infection in Orange County. This is a fluid situation, and Mr. Richard Sanchez, our Director of Healthcare Agency, will apprise you of the specifics later when you can ask him questions. But we have heard from residents that they would like to know more about basic information, such as how many test kits do we have on hand, and how many have been tested. Basic information like that. It would put a lot of people's mind at ease if we can let them know that we have the capability to test for suspected cases. And so with that, I would like to provide some numbers that are up to date as of today. We have 1,124 test kits for coronavirus COVID-19 on hand at the county. That means the County of Orange, not in all of Orange County. We have private health providers, doctors, hospitals, who have their own supply of test kits. And the county, we do our own testing, and the private sector also have their own labs, such as Quest and LabCorp, that do the testing, process, the test done by the private health providers. So for the test that we have on hand at the County of Orange, we have to follow CDC criteria before we test individuals for COVID-19. And this information that I'm providing now, based on the directive from the chair and myself, healthcare agency will have these numbers updated every day from here forward at 5 p.m. every day. So what we have behind all of us here is the website that you can log on, and at 5 p.m. every day you will get an updated number as far as active cases, the number of tests run, what capacity you have in the county. And mind you, again, I want to remind you that the numbers that we have are for us, the County of Orange, not to include capacity in the private sector. And by that I mean doctors and hospitals. And so the chair mentioned earlier that given all of the advisories that have come down and the declarations of emergency, we want to make sure that we are taking every step necessary to keep our people safe. And earlier today, our Orange County Public Health Officer, Dr. Nicole Quick, issued a recommendation that Orange County School cease their normal day-to-day instruction. She supports the Board of Education in their recommendation that the school district basically cease operation until the end of this health crisis. But we would recommend that the school resource centers that are operated by the school district remain operational, even though the schools do not operate, that the school resource centers remain operational to assist needy families with basic necessities, as well as childcare should the parents have to work. We know that this crisis has prompted a lot of actions that are evolving day to day, if not hour by hour. And so sometimes it would be very difficult for parents, especially lower income families, to be able to adjust their schedule and to accommodate childcare and meet the basic needs in the meantime. And so school resource offices are a critical part of meeting that need. But the county, we also run our own family resource centers that are located throughout the county. There are too many to list right now. I would encourage everyone who needs help to log into the website, contact the county, or there's a phone number. I know it says for the health referral line, but the help to our resource center can also be accessed through the same number. So if you can promote the phone number to the community, that would be great. We will send a letter, the Board of Supervisors will send a letter to the governor and our state representatives to urge them that the state should take all the steps necessary to keep school districts financially whole, so that the financial concern in addressing the risk of coronavirus isn't at all influenced by any financial impact to the school districts and to our students. And as the chair also mentioned, until the end of this crisis, the Orange County Board of Supervisors will be meeting weekly to guide our staff's action so that we can be effective and efficient in how we respond to this crisis. We will take all actions necessary to make sure that information reaches the public promptly. And the weekly meeting is a standing order, and of course, if there are emergencies that evolve, the chair can also call for emergency meetings as well. So the weekly meeting isn't the only time that we can meet, that we can actually meet more often than that. So what I'm going to do is talk about what are some of the things that we will do next Tuesday at the special meeting that we are calling. Is we will ask the CEO's office to make full use of the remote meeting capability. That means wherever possible we can do the teleconference attendance at meetings to minimize in-person contacts. We will post meetings notices for the County of Orange for all of our function on Facebook and on our Orange County website. So we don't want people to have to find a way to access notices or information. We will make our information available on Facebook as well. We will provide the information as quickly as possible, and we will also live stream our Board of Supervisors meeting through Facebook Live and YouTube also. So the intent here is to make it as easily accessible to people as possible. In our meetings, in the special meetings covering the emergency meeting agenda, we will cover things like testing, treatment, our response capability, the readiness, and also to help our community meet any kind of food or safety insecurities. Now we invite all representatives from the state and federal level to come to our board meetings to update us on things that they are working on any latest developments from the state and federal level. This way we will ensure that the Board of Supervisors have all of the information available in order to craft an effective response. I was notified that maybe my cell phone is causing this.
Yeah, it's the phone in front of you that, sir.
Oh, there's a phone in front of me.
Yeah, that
Oh,
phone
that
is-
one.
that one's causing interference.
Oh, okay, so it's not my phone. Okay, all right. Great. Still
Yeah,
happening.
you can do that.
Put it in his back then.
So to repeat, this is an opportunity for our local delegation at the state and federal level to come to the Board of Supervisors and inform us of all the measures that they are doing at the state and federal level, and also the resources that are available to help us. I'm going to ask CEO to form an ad hoc committee with representatives from all of our employee units so that we can craft a response plan that will ensure the safety of our workers. And we will redirect county staff and resources to complement and supplement our responses. For the most part, the work will be done by the healthcare agency. This is the time when we're going to break down the silo between departments. Wherever we need help, we should be able to marshal labor and also resource from other departments to come and help you, Mr. Sanchez. More importantly, we should not have anyone go hungry or lack resource because of this crisis. And so we will work with our community resource department and our social services agency to make sure that we make every available resource available and accessible to people who may need that help. We will work for, find a way to deliver food that will minimize person-to-person contact, such as have drive-up or delivery food service. And so the most important thing that we want to emphasize to the public is we have test kits that are provided to us at the state and at the federal level. And those are the only tests we have. As private labs or manufacturers come on board and ramp up capacity to manufacture more tests, we will have more available. But in the meantime, we have a limited number. And so we have to follow CDC criteria in administering those tests. But to the degree that the state or the federal agencies can provide more tests, we will make that available to the public. And so we will count on our local delegation to represent Orange County at the state and federal level. So that's it, and you can again log on at the website below behind me at 5 p.m. every day, and you will get an updated number on the condition we have here with coronavirus, COVID-19 in Orange County. Thank you. And here I'm going to turn over to Sheriff Don Barnes.
Prior to that, just drop the mic.
Sound check, everybody hear me okay?
Yes, sir.
Great, thank you very much, and thanks for being here today. Regarding the activities that are law enforcement related, including our jails, we made several changes over the last several days. First, let me preface this by letting you know that at the county level, for emergency management, the Sheriff's Department has had the Emergency Operations Center open at duty officer level. That has since been opened to level 2, which is the second highest level for the Emergency Operations Center. That's necessary, of course, to coordinate any resources that might be needed through the Regional Emergency Operations Center, through the state, or through the federal government. Requests would come up through the Operations Center and go out from there. It is challenging right now because as this unfolds, we want to make sure that we have a presence for those requests and manage those accordingly. Regarding the jails, we have visiting that was taking place. Yesterday I put out a press release instructing those who may come to visit, if it's not necessary, to not come, to follow the protocols that would be in place for everybody as far as stay home if you're sick. If you were visiting and had signs of illness, we would most likely turn you away. We do not have contact visits in our regular visiting, so the chances of our inmate population getting infected by somebody would be almost nil because there aren't inmate to visitor contacts. We are making the decision for the rest of the immediate future this weekend to cancel visits within the Orange County Jail, mostly for the protection of those who are coming to our facilities, not for the inmate or staff population. But we do have a tendency to have large numbers of people coming at one time. It would then qualify as a mass gathering type circumstance, and just to protect those who might be coming to the jails, we will be canceling visits throughout the weekend and will reassess if necessary. We have ongoing efforts to help educate the public in our calls for service. Our dispatchers are asking preemptive questions regarding health conditions if we are responding to an incident. Obviously, if it's an emergency, we'll respond and figure those things out when we get there, but if it's a call for service, a report, we want to make sure that everybody's well informed and our officers, deputies are also informed. And also for the public we're serving to have an expectation of what that service might be like. Notifying them of things like we are going to maintain social distance during that interview and things like that. As far as our jails goes, we are managed with the healthcare agency for both our medical and mental health treatment. For weeks now, we are not speaking for Director Sanchez, but they are asking questions for those coming into our jail, additional questions regarding COVID-19. Also, anybody bringing an arrestee to the jail, those officers will be asked before they enter the facility if the arrestee has any signs of illness that might cause us some concern. So for the most part, for us, it is business as usual. We put the same safeguards in place for our people. We're asking the same safeguards to be put in place for those we may be coming in contact with. And following those safeguards, we think we got out ahead of any potential issues. I would state that we have not had an issue of somebody infected with COVID-19 within our jail system. We have over 5,000 inmates in our care. And to give a moment, I think we've taken some good precursory efforts to make sure that any of those issues have not manifested or try to deter those as much as possible. With that, I'll turn it over to Director Sanchez.
Actually,
Okay, great.
I'm going to bring out Orange County Department of Education Health Coordinator Conf.
Good afternoon. As you probably know, Dr. Alma Harris, the superintendent for the Orange County of Education, this morning issued a statement saying that in consultation with both our public health officials and our school district leaders, we at the Department of Education, Dr. Alma Harris, are supporting the decision of school districts to close. At this point in time, from what I understand, it will be for a period of up to 2 weeks. However, of course, that will be evaluated on an ongoing basis. I don't know which districts specifically are closing at this point in time. I do know that many districts are calling emergency school board meetings to make that decision on when to close. As of now, I believe it will be as of Monday, as I say, for the next 2 weeks. We are concerned, of course, about ongoing instruction. On the continuation of learning, we are working with districts. Many of them have safe school plans, including pandemic planning in place to support learning during this time. And of course, as was mentioned before, we are worried about getting food to our students that rely on the schools for their breakfast and their lunch. We'll be working with city and county officials to keep that resource going for our school children. As far as financial relief for the districts, they can apply to the California Department of Education for something called the J13A waiver, which will supply funding during emergency situations such as this. A lot of this we're ongoing. This is uncharted territory, as you know, so this is the best we've got going right now, best of my knowledge what is happening, and we'll take questions at the end.
I would like to thank the Board of Education, especially the superintendent, for taking such swift action to protect our students. And we will endeavor to work with the school board and the school district throughout the county to make the resources available to our needy and probably vulnerable population in our community. To answer questions, I believe you.
Good afternoon. The Orange County Fire Authority and all fire agencies within Orange County are operating at full capacity. All of our paramedic engines, trucks will be responding as normal. Our dispatchers are taking precautions in the call taking phase to alert our first responders as to any potential coronavirus exposure. Our crews have been trained and are ready to respond to those incidents. They have the precautions in place with our policies at this point. We will continue to serve the county as we have every day. You know that when you call, the fire departments will respond as we have in the past. We ask that you take your own precautions, wash your hands, do all the things that are recommended on the website through the county. Thank you.
Thank you, Captain. So I will leave you now for any questions you may have to our first responders, both health and safety. So next up, I would like to invite our Director of our Healthcare Agency, Mr. Richard Sanchez.
Thank you, Vice Chair Doe. If there's any message that I'd like to give today, that is, I would encourage the residents of Orange County and anybody who's interested to look at our website. It has information for all our providers, hospitals, and the general public. And I know many of you have heard this many, many times, but washing hands, staying home when you're sick, not touching your face, if you're in a vulnerable population, over 60, chronic conditions, make your best effort not to be in an environment where you may come into somebody that may be ill. That is a big message that's coming out from both the federal level and the state level, and that is something that we're following consistently across the nation. So I appreciate the efforts by both President Trump in declaring the emergency, Centers for Disease Control and the information they're providing, and the California Department of Public Health for the information they're providing to local health officials. And with that, I think we're ready to take any questions.
School, Superintendent, can I ask you a question on that? Could you clarify? You said that I think the superintendent supporting the schools, but is he recommending the schools close down?
Right. Now, the language that is used is where the Department of Ed and the Department of Ed and the Superintendent Almahar's is supporting school decisions. Each district gets to make their own decision about their choice to close or not. Many of them have expressed concern. Parents have expressed concern over the last few days, so we've been having discussions with the districts along with our Orange County public health officials, and we are in support of the district's decision to close, but we are not recommending it or mandating it.
And is there anything financially or otherwise that your office can do to help those districts if they do decide to do that?
Right, that's what I briefly mentioned. There is a waiver that school districts can apply for with the California Department of Education in case of emergencies like this to continue ADA funding, et cetera, so that school districts don't take a big financial hit during times like this.
And can you explain that? That's because, are you talking about because they get paid per student per day in
Correct.
class?
For
Can you talk
ADA,
about
we
that?
get average daily attendance. Schools get a certain amount of money every day depending upon their attendance. Most districts operate that way. And if students aren't in school, of course, the districts would lose the funding for those students not being present. And this waiver allows school districts to apply in cases of emergencies like this for the Department of Education and legislators to make up that funding.
Is this only for public schools, this waiver?
I believe the waiver is, private schools operate very differently. They operate under different codes and et cetera. So I believe that that waiver is just for public schools.
Okay. And then you also mentioned that the resources will still be available for families who may be low income.
Right.
So now we're talking about maybe still having children gathered in an area during school programs. What are the precautions that are in place to protect those children from carrying the virus home, for
Right.
example?
Well, first of all, Supervisor Doe did mention how we are going to try, and it's all new, we're just figuring this out, but how we're going to try to figure out ways of distributing food that are socioeconomic status, lower socioeconomic statuses rely upon. And we're going to try and figure it out so that it exposes them the least amount in crowded areas. That, like you mentioned, delivery on one-on-one. Perhaps we'll have families come in at certain times. We don't know all of this yet. Our primary goal is definitely to keep our children fed that rely on us for meals. We haven't worked out the operational task of that yet, though.
Do we know when an expected when an answer is expected, since a lot of these schools are going to close
Well,
Monday?
schools are probably going to close on Monday, so I hope by then we will have an answer in place of how these procedures will take place for these kids, because that is a paramount, that was one of the big concerns when we talked about school closing, is how are we going to feed our kids? Even before the learning continuation, we worried about feeding them.
Richard, can you speak about the testing capabilities, about, do you know what the capacity is in the private sector of test kits? And can you talk about how the county is prioritizing the 1,024 kits that the county has? How do you prioritize use of those?
So in terms of the county's response, we are given test kits for a specific population. And that population is those that have been identified both by the Centers for Disease Control and the California Department of Public Health as priority testing to stop disease spread. And know that what my agency is about is stopping disease spread. So there's 3 criteria for that population, and I'm going to let David Solelas, the Director of Public Health, give those 3 criteria.
Thank you. Yes, so for testing through the Public Health Laboratory, we're currently testing individuals who have had travel history to areas with widespread transmission and who are exhibiting symptoms. We are also looking at individuals who are close contacts with known COVID-19 cases, so that, and who may be exhibiting symptoms, so that we can do the testing there. And then for persons with severe respiratory disease who may not have any other travel history or contact history, we will be doing testing on those individuals, and that's done in consultation with their medical provider, communicating with the public health department within the healthcare agency to make those arrangements for testing.
To this point, have you had enough tests to meet the demand for the tests in Orange County?
Yes, I was going to follow up on the previous question on the test kits. So the test kits are provided, that we get, are through the government. So they're specifically for that purpose of testing the population that David mentioned. Mentioned earlier was private testing. There is a requirement currently to get a test from your private doctor that he has to write a note for that. So you can't just show up and say, I want a test. And know that that test would not be conducted at our clinic. It would be conducted at some other lab or some other site. We only do the testing for the population that David mentioned in his talking points. Know also that there is, the test kit question has come up very often, and even today I gave a different number because what I said is the test kit isn't an individual, one patient, one test. So what we did is figured out the capacity of the number that I'd given out earlier, and that was the number that we gave out earlier, 1124. So we have current capacity, and know that that's a revolving number. So as we go through tests, we may be replenished with more test kits from the state or the feds, depending on our need. We feel we have sufficient number in the moment. That will change, and it's likely that we will get more test kits. And to your question about the number that's available privately, we work with them, yes, but mostly in the identification of positive tests that they do receive. In other words, if you get tested privately by LabCorp or Quest, and the test is positive, they are mandated to report a communicable disease, so they will let us know so we can do follow-up. And so for individuals, and I think this has been covered previously, that test positive, they are isolated, meaning they are monitored daily with symptoms, and they are not tested to clear them from that until they no longer have symptoms. Those tests have to be done twice, 24 hours apart, and test negative.
Do you know what the capacity is in the private sector for that?
I do not. We are working on finding out, though.
How many people have been tested so far?
So through the Public Health Laboratory, we have tested 134 people to date.
To be clear, if there's a positive on one of the private, like a Quest test, and you're alerted to it, do you then test them again through your methods, or do you rely on the Quest test only?
At this point, we will rely on the testing capabilities from the private laboratories to take appropriate public health precautions as soon as it's reported to us.
The 9 that you have with coronavirus, have any of those come from your testing, or everything you've tested, 134, have been negative so far?
So the test results, the testing that we have done have come from a combination of tests done by our public health laboratory, and initial testing that was done by the Centers for Disease Control and Prevention, because if you recall early on, the only lab that was testing was the CDC, so some of our initial positives came just from that testing. And then we have been starting to get reports from the private labs of positive results.
Are any of the 9 cases, are they hospitalized or are they all in self-quarantine?
All of the current cases are in appropriate isolation. I don't have the breakdown of hospitalized or vulnerable.
And do those 9 cases include the one that is already fully recovered?
Yes, that's a cumulative case count from the beginning, so 9 total, including our initial case that had already recovered.
How many of the 9 have come from private testing, do you know?
I'm sorry, I don't have the breakdown of the number that have come from private versus our lab.
Sheriff, one follow-up with you, just to clarify on the jail visits. Were you saying inmate visits will go on, but other type of visits won't, or will people be able to visit inmates this weekend, or no? I just wasn't clear on that.
Just for clarification, Chip, our visiting in Orange County Jail is not face-to-face. It's not contact visits, so it's between a barrier. So the likelihood of an inmate in our care being subjected or contaminated in a visit is non-existent because they don't have contact visits. Our concern are the public coming to our visiting in the Friday, Saturday, Sunday, Monday, especially the Sunday, Monday is usually large numbers that come. They kind of stage in the visiting area. They're in close proximity. And as a preventative measure for the public, not for our inmate population, we're going to be canceling visits for that reason. I hope that I answered your question.
Okay, so they won't be able to visit inmates?
No, there will be no visiting. Attorney visits will still take place. They're a much smaller number. We hope that they maintain all the safety precautions that everybody else would upon visiting or coming to our jail. But normal visiting, as it would normally occur on those 4 days, will cease and we'll reevaluate that next week.
Is there a plan to announce further information on who those patients are, like the location or anything like that?
As you may know, in the health world, we have to follow certain privacy rules related to health information. It is protected by both the federal and the state government. And so what we release is an age range and a gender. And that basically they're in Orange County. So that's the information, to protect privacy, that's the information we release.
Do you anticipate getting more test kits? How do you respond to some of the popular concerns about there not being enough test kits? You said earlier you were comfortable that we had enough at 1124. Do you think that'll stick?
Just to be clear, Norberto, I'm saying that we have enough test kits currently for the population that we will be testing. There is a lot of concern in the community, and we totally understand that, and we've gotten those calls as well. And I know there's some frustration that the government lab can't test anybody who requests it. We hope that Quest Labs, LabCorp, and other providers increase their availability so a doctor can refer a concerned individual based on their criteria, not ours, on who should get tested or not. And I would add that it's inevitable that as we test more, it is likely that we're going to see more positives. So, we know that's probably going to happen.
How's it going talking to the private sector? Are they telling you that they need any help to get more kits, or are they telling you that they have what they need?
Without knowing what the need is. So, it's everything from I walked by a person who coughed and I want a test kit to I'm ill and I traveled and so I want to know. Not necessarily to one of the countries. So I couldn't guess what the number of test kits are needed in the private sector. I would add though, do we need more? Yes, it would be nice to have more, absolutely.
What did they tell you they need?
They have not mentioned a number.
Let's go for one more question.
There are 5 people, according to your chart, that are, well, 3 of them are 50 to 64 and who have been confirmed positive cases, and 2 of them are 65 and older. We know that the older populations tend to be more vulnerable to this. Can you tell us a little bit just about how they are and how they're doing in terms of recovery?
I think what we can say is the first case has fully recovered. That's pretty much, other than releasing private health information, that's pretty much what we can say at this point. But I will say, it's evidenced by the numbers you just cited. Elderly people, people who are of certain age should be cautious. People who have chronic conditions should be cautious. And that is consistent with the guidance that we're getting from the federal government and the state government and is on our website. So just, that's something for the public to absolutely be aware of.
Thank you.
Thank you all.